Hey everyone, welcome to Sisterly Health, where we discuss all things related to women's health and well being. Today's topic is something that every woman can relate to: dealing with your period. While it's a natural bodily function, there are certain things you should avoid doing during this time of the month to prevent discomfort, pain, and potential health risks. In this video, we will be discussing the 22 things you should never do while on your period and why. So if you want to learn how to make your period less of a hassle and more of a breeze, keep watching. 1. Don't skip meals. During your period, your body is expending extra energy to shed the uterine lining. Skipping meals can lead to low blood sugar levels, which can cause fatigue, dizziness, and mood swings. It's important to eat balanced meals and snacks throughout the day to keep your energy levels up. 2. Don't consume too much caffeine. Consuming too much caffeine can exacerbate PMS symptoms such as irritability, anxiety, and insomnia. It can also cause dehydration, which can make cramps worse. Instead of drinking caffeinated beverages, try herbal teas or decaf options. 3. Don't wear tight clothing. Wearing tight clothing, such as skinny jeans or leggings, can restrict blood flow to the pelvic area and increase discomfort. Choose loose-fitting clothing that allows for movement and breathability. 4. Don't forget to exercise. Although it might be tempting to skip exercise during your period, it's actually beneficial to stay active. Exercise can help reduce cramps and bloating, boost mood, and improve sleep quality. Just make sure to listen to your body and avoid high-impact activities if you're feeling particularly uncomfortable. 5. Don't engage in high-intensity exercises. High-intensity exercises can cause abdominal pain and discomfort during your period. Instead, focus on low-impact exercises such as yoga, walking, or swimming. 6. Don't use scented products. Scented tampons, pads, and wipes can irritate the sensitive skin in the vaginal area and increase the risk of infection. Stick to unscented products and consider using a menstrual cup or cloth pads instead. 7. Don't engage in unprotected sex. During your period, you're at a higher risk of contracting sexually transmitted infections, STIs. Additionally, menstrual blood can interfere with the efficacy of condoms and other forms of birth control. Use a barrier method such as a diaphragm or cervical cap, or avoid sex altogether if you're not in a mutually monogamous relationship. 8. Don't ignore unusual symptoms. If you're experiencing unusually severe cramps, heavy bleeding, or other symptoms that are interfering with your daily life, it's important to talk to your healthcare provider. These symptoms could be a sign of an underlying condition, such as endometriosis or fibroids, that requires medical attention. 9. Don't overdo it on painkillers. While painkillers can be helpful for managing cramps and other period-related symptoms, it's important not to overdo it. Overusing painkillers can cause rebound headaches, gastrointestinal problems, and other side effects. Stick to the recommended dose and consider alternative methods of pain management, such as heat therapy or acupuncture. 10. Don't neglect self-care. Taking care of yourself during your period is important for your physical and emotional well-being. Make time for activities that help you relax and distress, such as taking a warm bath, practicing yoga or meditation, or reading a book. 11. Don't ignore your body's signals. It's important to listen to your body and rest when you need to. Pushing yourself too hard during your period can make you feel more tired and stressed. Pay attention to how you feel and take breaks when necessary. 12. Don't forget to stay hydrated. During your period, you may experience increased water retention, so it's important to drink plenty of water to stay hydrated. Drinking water can also help alleviate bloating and constipation. 13. Don't eat too much salt. Salt can cause water retention, leading to bloating and discomfort. It's best to avoid foods that are high in salt, such as processed and fast foods. 14. Don't forget to change your tampon or pad frequently. Wearing a tampon or pad for too long can cause unpleasant odor and increase the risk of infection. It's important to change your tampon or pad every 4 to 6 hours or more frequently if you have a heavy flow. 15. Don't ignore your iron intake. During your period, you lose blood, which means you also lose iron. Iron is important for maintaining healthy blood cells and energy levels, so it's important to include iron-rich foods in your diet, such as spinach, lentil, and red meats. 16. Don't consume alcohol. Alcohol can disrupt your hormone levels, making your period symptoms worse. It can also lead to dehydration, which can exacerbate cramping and headaches. 17. Don't forget to rest. Your body is working hard during your period, so it's important to give it a break. Make sure to get plenty of rest and sleep to help your body recover and recharge. 18. Don't hold in your urine. Holding in your urine can put pressure on your bladder and worsen cramps and bloating. Make sure to use the bathroom regularly during your period to avoid exacerbating your symptoms. 19. Don't use expired or outdated menstrual products. Using expired or outdated menstrual products can increase your risk of infection and irritation. Always check the expiration date on your pads and tampons and replace them as needed. 20. Don't take hot bath. While a warm bath can help ease cramps and promote relaxation, hot bath can actually increase blood flow to your pelvic area and worsen heavy bleeding. Stick to warm or lukewarm bath during your period to avoid exacerbating your symptoms. 21. Don't ignore excessive bleeding. While it's normal to experience some bleeding during your period, excessive bleeding can be a sign of a more serious issue like endometriosis or fibroids. If you notice that your bleeding is heavier than usual, lasts longer than 7 days, or causes you to pass large clots, it's important to talk to your doctor. 22. Don't feel ashamed or embarrassed. Lastly, it's important not to feel ashamed or embarrassed about your period. It's a natural body function, and millions of people around the world experience it every month. If you feel self-conscious, try talking to friends or family members who can offer support and understanding. You can also seek out online communities or resources that provide information and education about menstruation. By following these tips, you can manage your symptoms more effectively and maintain your overall health and well-being. Remember to listen to your body and give yourself the care and attention you deserve. If you found this video helpful, please consider sharing it with the women in your life. Let's break the taboo and help each other live our best lives. Thanks for watching, and we'll see you in the next video.